Good morning. My name is Cathy Shea. Welcome to Spa Shea. I want to acknowledge you for blocking time in your day to come and learn. I enjoy learning too, so that's why I teach. I grew up in Pittsburgh. I'm one of 10 children. And by the time I was 12 years old, I had a mouthful of heavy metal mercury fillings. In fact, I had 20 of them, 5, 10, 15, 20. So every day after school, I would be at the dentist's office while the other kids were out playing, getting drilled and getting filled. And of course, back then, nobody knew. Nobody knew. So over the course of my life, many, many years, I developed all kinds of symptomology, ranging from chronic headaches, menstrual difficulties, yeast infections, jaw pain, irritability, blood sugar challenges. I couldn't get my blood sugar regulated no matter what I ate. Finally, in the late 80s, I stumbled upon a natural doctor who did muscle testing, also known as the science of applied kinesiology. Because none of the tests, medical tests, showed anything wrong with me. They kept telling me it was all in my head, and I said, "You're right." And I found out it was all in my head, literally. It was in my teeth. What I didn't know was the metals were creating what is called a galvanic field. It's an electrical field, and it was scrambling the circuits of my brain. Couldn't remember. Too young to have all this symptomology. This was all happening between the time I was like 20 and 30. So this natural doctor who muscle tested me said, the first thing you need to do is cleanse. And I said, well, what do you mean by that? And he walked me across to the other office in his space, and he showed me this device, and he said, what do you know about colon cleansing? And I said, well, my grandmother used to give us enemas all the time. We had 10 kids. Nobody faked being sick. Otherwise, you got the enema thing, right? So I knew the concept, but I had never seen a device like this. But I signed up right away. I had 2 colonics per week for 6 weeks. And after the very first one, my headaches disappeared. I had been tested for glasses, and they couldn't get my vision corrected. After the 6th session, my eyes cleared. Perfect 20/20 vision. It was really an amazing awakening for me, and it drew me into this field of study. So as I began to explore even more, I found a doctor by the name of Thomas Rau. He's a medical doctor from Switzerland. And if you go to his YouTube channel, you'll learn a lot about all of this. Because what I didn't realize was every time I ate something, I was actually swallowing the residue of heavy metal. It was going into my gut lining. I was actually breathing the vapors. There's a YouTube video that shows the vapor every time you chew with metal in your mouth. There's a vapor that comes out. My lungs were compromised. I finally ended up with pneumonia, and that's when I started to look very seriously at doing a more deep heavy metal cleanse. I'm actually in the middle of that right now. Don't I look great? I can't tell you how much better I feel, honestly. I'm working with a local doctor by the name of Bruce Dooley, who is also on the foundation ambassador team. We're doing IV chelation to help clear this heavy metal from the cellular activity. And I'm also doing oral chelation because there's different substances that respond to different metals. I have colonics at least once a month. My husband and I travel the world teaching, and every time we come back from an airplane ride, the first thing we do is a 24-hour cleanse. You've seen the smoothies. You're going to have a beautiful lunch, all organics. We're doing our best to, as Dr. Rao would say, reduce the toxic load. He's probably the most animated little Swiss guy I've ever seen, and I love him dearly. I'll be studying with him again in October this year for an update. So today is about sharing with you how important the gut is. I'm sure you've been reading about it. It's all over the newspaper right now. It's making headlines every day, which just warms my heart because that wasn't the case even 3 to 5 years ago. So the gut is now being considered our second brain. Every chemical that's made in this brain is also made in the gut brain. What most people don't know is that 95% of our serotonin is made in the gut, in small intestine. So this happy hormone that helps us regulate moods and emotions is actually going to depend on the health of your gut. So this second brain is generating all kinds of communication up to your head brain and back down again to tell us, well, are we safe? That's the main question that the gut is wanting an answer to on a regular basis. Are we safe? We studied with another professor by the name of Stephen Porges up in University of North Carolina, and he's written a book about babies who are constipated. It's a segment in his book on the polyvagal theory, and this is the nerve that generates safety or not in our brain, upper brain. He's written very eloquently about how babies who do not feel safe become constipated. So these children, mothers who bring me children, and I don't know why this child is constipated. We feed him well, he gets plenty of exercise. What's the environment in the home like for this child? That's the question we have to ask. Because this second brain needs tenderness. The gut needs tenderness and safety. Some of the things that have really, really helped me along that line are using Young Living oils, especially lavender. If I wake up in the middle of the night, my tummy's upset or a little bit bloated because we had dinner out or whatever, I could put 2 or 3 drops right in my belly button and it settles my belly immediately, back to sleep. I've also taken it upon myself to do a little abdominal massage every morning before I get out of bed with some of the lavender and just talk to my tummy. Start loving my belly. For years I lived in Miami and I was a runway model for bathing suit companies, and I had this marble flat belly, and then menopause showed up. And all of a sudden I had this pooch. Well, I gotta love the pooch because it's here to stay. So being able to be in my body in a loving way has probably helped my digestion more than anything. And simply accept my body as it is. Body is so intelligent. This second brain is actually autonomous, and it has more neurons than this brain and spinal cord combined. So it's quite fascinating. When there's a complete sever of the spinal cord, this gut keeps working. How is that? It is that because of the enteric nervous system. Now, you may not want to study this unless you're really interested in the depth of this. This second brain book is not an easy read, but this is where I get a lot of my information from Dr. Gershon. This enteric nervous system speaks to this head brain through what is called the autonomic nervous system. When you think of autonomic, I want you to think of the word automatic. Blood flows, heart beats, eyes blink, digestion happens. It's all automatic because of this incredible autonomic nervous system. And the 2 branches of this system are giving us the information we need for digestion. Are we safe? That's our relaxation response. Can we go to sleep? Can we relax? Or do we need to do the fight or flight thing and get out of there? We've all gone into places where you just got this feeling in your belly and you're like, didn't want to stay there. Trust your gut. Trust your gut. The gut needs time, especially time to eat the food. We have a signaling system from the stomach through the enteric nervous system up to the head brain that signals a hormone in the stomach called leptin. Leptin tells us when we've had enough food and we're satisfied. If we eat really, really quickly, we short circuit that signal between the leptin telling the brain that it's eaten and we eat more and more and more and more and more. This is a cause for overeating. That signal can take 20 to 30 minutes for satisfaction to actually register up here. So I love when we teach in Spain or in Italy or in the Mediterranean countries, because they're all really leisurely at the table. They take hours for their meals. It's so wonderful. And they never overeat. It's very rare you see a heavyweight Italian person. They're usually very slender. They take time at the table. We also need to take time at the toilet. So now we're going to get down and dirty. Pardon the pun. So time at the table and time at the toilet. The signal for going to the bathroom should not be painful, ever. I'm going to repeat that because it's really, really important. Most people are waiting for this big event to tell them to go to sit on the toilet. The signal for going to the bathroom and to have a bowel movement should never be a strong, uncomfortable, or painful feeling. And I think this is where a lot of people get in trouble with constipation. They miss the train. They miss the signal. It can be quite subtle. For me, the signal might even be just a slight little wave of nausea. It could be a hot flash. I blame it on menopause, but I found out it's my bowel. Well, guess what? They're all connected. So, listening to the body for that subtle signal, getting to the bathroom, and then sitting with your feet up. Many of you have already seen our little step and go in the bathroom. I heard it made Shark Tank, and now it's all over the place, especially Bed Bath & Beyond. So the feet are elevated, and you become squatted. In a squatting position, the pelvic floor opens. There's no strain. This is particularly helpful for people who've had hemorrhoids, because they have a tendency to sit and push. And the more you push, the less you get. That's pretty much in life as well. So if you could sit quietly, I do a lot of my spiritual reading in the bathroom, my feet up. We even do colon yoga, where we do a little stretching while we're on the toilet and press these points along the outside of the arms. These are colon points. It'll oftentimes stimulate a bowel movement. Now, most people will have their bowel movement, clean themselves up, get up and leave. So I'm going to challenge you to wait for another wave, because the longer you wait, you may get another bowel movement if you give it time on the toilet. And please turn around and look. Does it float? Does it sink? Is it a lot of mucus in there? If it is the mucus, there's an irritation of some kind. Something's not right. Good heavens, if there's blood, call your doctor. That's the only way to go with that, okay? So take time in the toilet. The gut needs the right temperatures. What does that mean? Very simple. Nothing leaves your stomach until it reaches 98.6. I work with a lot of clients who are raw foodists, and I can actually inspect their fecal matter as it goes through the tubing in this device. And I see the carrots and the salad. Yesterday I saw the head of a piece of asparagus going right by, undigested. They're spending all this money on organic food at Christopher's Kitchen, buying all these expensive, beautiful, raw foods, but they don't have the digestive fire to break it down and actually assimilate it. So it's going out the same way it went in. So I do my best to allow people to have whatever dietary requirements they like. And if somebody is a raw foodist, I will offer them a very simple idea. Have a little bowl of soup before you have your salad. Have a cup of hot tea before you have your salad. What about a little cup of hot water with lemon? Lemon will inspire your stomach to create more acid and break down that food. Just little, something little like that. The very next day, this person had 50% less undigested food, just from changing that timing and temperature on what they were eating. So remember that this gut thrives on digestive fire. It's got to have heat. You can also take your salad, maybe sprinkle a little bit of ginger on it. Ginger will create fire. So adding spices, cinnamon is good, cardamom is wonderful, cumin is excellent. So if they're eating avocado, they can mash it with cumin and you got a great guacamole and you got the fire you need to actually absorb the nutrient. So it's a wonderful way to just make small changes. It can make a big, big difference. The gut needs time for transition. What does that mean? Well, after you chew your food, please chew it at least 32 times. You have 32 teeth. Make sure it touches each one. This will also help with the transition because the more you chew, the chemicals that you secrete in your mouth are actually sending electrical signals to your stomach that says, incoming, we're going to have food coming down soon. So now the stomach gets prepared. While you're chewing and your stomach is getting prepared and secreting more acid and getting ready for that incoming, your gallbladder gets in on the act. There's another pathway, and the gallbladder says, oh, they just had an avocado or they just had a filet mignon. There's going to be some fat here. I better get to work with some bile. Because the gallbladder has the bile that's going to go into the small intestine and help break down the fat. It's also going to neutralize the acid when it gets in the small intestine. So these transition points are very important. Your stomach is so intelligent, it will only let out 3 to 5 tablespoons of your digested food at one time into your small intestine. Pretty cool. How does it know when to open and close that little valve? We have all these little valves that create these transitions. They rely on relaxation. If there's no relaxation, there's no good digestion. If there's no relaxation, there's no good bowel movements. So all of this is, going to depend on this enteric nervous system and that second brain feeling safe, feeling relaxed, and being able to take the food in joyously. God gave us taste buds. We're meant to enjoy it. It's supposed to be pleasurable. We don't just eat to survive. It's supposed to be a pleasurable experience. So I would invite you to explore whether you might use food for pain, punishment, versus pleasure. This is very often the dynamic I see with a lot of my clients. They're really struggling between these challenges. I've worked with several people, men and women, who have been diagnosed with eating disorders. This is a big challenge because, we can live without drugs and alcohol and gambling and sex and, shopping and all these things that are out here, but we can't live without food. So this challenge with eating is very, very much the biggest and most difficult of the addictive cycles. So helping them to come to terms with the way they've punished themselves with overeating or bulimic behaviors or whatever has been a really beautiful part of my work. And of course, we refer them to other therapists who are qualified to help them with psychological material. That's not in my scope of practice. But simply helping them and nurturing them and finding ways for them to go back to be more tender with their bodies and more loving with their bodies has been very rewarding for me over the years. So these 4 places where you pay attention to digestive activity, time, tenderness, the temperature, and transition. Of all the tips I can give you, this is a really good synopsis of how it would work in an ideal environment. So what we want to be able to do is increase function, improve function, and make choices that are going to support us to do that. So thank you.